Now, I'll be talking about one of the most important topic, that is low molecular weight heparin or LMWH. The most commonly used low molecular weight is Clexane or Enoxaparin. Now we must know this is very extensively used drug almost all over the world, especially in ICU. Now why it is called low molecular weight? Because the weight of this is less compared to unfractionated heparin. So the weight is only 3000 to 7000 Dalton. Now the property of this is it selectively inhibits the factor 10A, that is activated factor 10A, as well as it increases the efficacy of antithrombin 3 by 100 to 1000 fold, so that the thrombin is effectively removed from the circulation, and that is how it has an excellent anticoagulant property. It has very little effect on factor 2A, and it has very smaller effect on activated partial thromboplastin time. So this doesn't APTT doesn't get affected much in Clexane, whereas this is markedly affected in heparin when heparin is used. It also has very little effect on platelets, so the chances of this thrombocytopenia is very less when compared to unfractionated heparin, where heparin-induced thrombocytopenia is very common, and they affect platelets at a larger scale compared to this lower molecular weight heparin or Clexane or enoxaparin, and they have compared to very much lesser incidence of hemorrhage when compared to heparin, that is unfractionated heparin. So unfractionated heparin very commonly, almost always, very commonly they can cause hematuria or bleeding from other sides as well. But the chances of this hematuria or bleeding is compared to much lesser with this low molecular weight heparin. One of the excellent property of this low molecular weight heparin is its availability. As the size is very less, as soon as we give it subcutaneously in subcutaneous injection, it can gain access very easily, and it can get into the circulation very easily. Whereas in heparin, the size is much large, so as soon as it enters blood vessel, it kind of gets accumulated first nearby over the endothelium, and as we keep on giving heparin again and again, then the later dosage given of heparin enter into the circulation. But this happens much lesser with the low molecular weight heparin because of the lesser size, so the availability is much better, and that is around 70 to 90%, which is only around 20 to 30% when we discuss about unfractionated heparin. The half-life of this low molecular weight heparin is 4 to 6 hours. So almost this drug acts for around 24 hours. That is the reason why if we intend to do an elective surgery, we usually withhold the Clexane at least 24 hours before the elective surgery. Uh, it definitely does not prolong APDT, so there is no monitoring of APDT or INR is required whenever we are giving low molecular weight heparin, and it is almost equally effective as unfractionated heparin. Now, what are the uses? One of the most important use is prophylaxis. So we use this drug for prophylaxis of DVT and obviously P. When there is no DVT, the chances of P pulmonary embolism will be much lesser. To all the patients who are undergoing surgery or who undergo surgery, or those patients who have stroke, those patients who have poor mobility, or those patients who are immobilized, those patients who are very sick, those patients who have sepsis, who cannot walk, who are more of a bedridden in the hospital because of the infections or because of some other reason, or those patients who have very bad pneumonia, elderly, immobilized, and with high inflammatory markers. There, the chances of DVT because of the poor immobilization is very high, because of the inflammation is very high. So, immobilization or poor physical activity and inflammation, this is one of the most important factors for development of the thrombosis or deep venous thrombosis. So to prevent that, the prophylactic dose Clexane can be given, and usually zero point 0.6 or 60 milligram once a day is given. So for prophylaxis, once a day dosage subcutaneous is sufficient. And whenever there is DVT for treatment of deep venous thrombosis, enoxaparin or Clexane or this low molecular weight heparin 60 milligram, which is equivalent to 0.6 ml, is given uh, till the patient is hospitalized. Whenever the patient is discharged from the hospital, either a bridging of 5 days with warfarin is done already, or the patient is discharged on apixaban or rivaroxaban or dabigatran, whichever oral novel anticoagulant is used by that particular institute. Any patient presenting to the hospital with chest pain who may have ST elevation MI or non-ST elevation MI or unstable angina. All these patients specially are given injection Clexane or low molecular weight heparin twice a day till the patient is hospitalized, mostly for around 7 days if the patient is staying. And for post-MI patients, post-angioplasty patients, it is definitely given till the patient is hospitalized. One of the most important indication is cortical venous sinus thrombosis. In here, low molecular weight heparin is an excellent choice, and it is also given in therapeutic dosage, that is 60 milligram twice a day or zero point 0.6 ml subcutaneously twice a day, at least till the patient is hospitalized. When patients get stabilized, especially after 7 days to 10 days, then patient is discharged on novel oral anticoagulant drug, which are always rivaroxaban or which are apixaban or dabigatran, or warfarin can also be used. But for warfarin, you have to keep on doing the INR monitoring. But for these drugs, you don't have to do any INR monitoring. And warfarin takes at least 3 to 5 days for its effect, whereas these novel oral anticoagulant drugs, they start acting immediately. Whenever there is kidney failure, usually heparin is preferred compared to Clexane, because Clexane goes through kidneys. So in kidney failure, the Clexane or Enoxaparin or low molecular weight heparin concentration may be higher, and it may lead to excessive bleeding, and it has a longer duration of action. So to terminate the duration of action faster and to have a lesser risk of heparin-induced bleeding, in kidney failure patients, usually instead of low molecular weight heparin is preferred. So this was all about Clexane today. Thank you.